Minister of Health, Dr. Osagie Ehanire. Good evening and welcome to the program.
Good evening.
All right, before we get started, let's take this report. The Federal Capital Territory is among states with recorded cases of COVID-19 in Nigeria. How are the authorities responding to emergencies? Hakeem Aliyu tells us the measures in place.
Nigeria is among African countries affected by the novel coronavirus disease, COVID-19, with figures rising. Before now, perceptions over the readiness of the authorities to effectively contain the outbreak of COVID-19 was a theme of heated debate, as many felt a lot more needed to be put in place. In the Federal Capital Territory, there are 2 isolation centers located at the University of Abuja Teaching Hospital, Gwagwalada, one already in use with 25-bed capacity, while the other is under construction.
You know, the national protocol is until you confirm you don't take for treatment center, there is self-isolation, quarantine yourself by yourself. If you develop symptoms, you invite us, we come and take samples, then test it. If you're positive, then we take you to isolation stroke treatment center.
Some facilities in the territory have also recently been converted to isolation centers.
In the next 1 week or few days, it will come on board. He identified Zuba Hospital, Karu Hospital. We are working on them.
The authorities noted that basic equipment for patient medical personnel are being worked out to meet the needs for the effective management of COVID-19 pandemic. Many are of the opinion that critical to this fight is a more sophisticated and practical steps in contact tracing, emergency evacuation, and trained medical personnel. In Abuja, Hakeemat Aliyu, NTA News.
Thank you, Hakeemat, for that report. Honorable Minister, there's one particular issue that many Nigerians have been talking about, and that's the lack of a geographical spread with respect to the test laboratories in the country. Tell us more about it.
Well, you can imagine that the spread of the laboratories will follow also the spread of the disease, the presence of the disease. There are states where you have absolutely nothing at the moment, and the states who have a lot of cases and a lot of contacts that we are looking at. But there are 2 things. We are expanding the laboratory assets we have. We have 6 functional now. 1 functioning since just the beginning of this week. That's Ibadan. We are going to have more functioning in Abakaliki very soon, in Kaduna, Kano, and Maiduguri. So we are expanding the laboratory assets and testing centers that we have. We're also talking with private laboratories to see which of them can be converted to test for coronavirus. As you know, not every laboratory can test for it. So if we're able to expand the assets, then we have more testing. But we must follow a pattern, and the pattern is to look for those areas where we suspect the most patients will be, the most affected, and not necessarily look at an even geographical distribution. That will come up as the case continues to grow. But we hope it doesn't get to that level.
All right. Now, what about the test kits? It seems to be one of the major complaints across the globe, lack of test kits. Do we have enough of it? And we also learned that the Chinese philanthropists donated some of them. What we have presently, can it be said to be adequate, for carrying out the tests that are required?
No, there is no country that will tell you that they have adequate numbers, because the numbers are growing more than some countries imagine. They didn't imagine that they would need so many test kits, or that they would require so many beds or so many ventilators. No country planned for it. No country is able to actually cope with the numbers they have. In our own case, yes, we are trying very hard to make sure that the cases that require all these needs are few by being as proactive as possible. We are looking particularly at the entry points of Lagos and Abuja, where we have the international airports, and most of all the cases we have been imported from outside the country.
Okay, Now, we learned today that America has developed a test kit that can give you a result within 15 minutes. Do you have an idea about that? And if that is true, is it enough to go around the globe, assuming nations that are involved in this begin to request for it?
Well, for one thing, people are looking for test kits that will give them fast results, but the results must also be reliable. You have serological tests, and you also have PCR tests, which are molecular diagnostics. But we follow what the World Health Organization recommends, and because the results you get must be credible, they must be believable. And we have enough kits now to last us for some time. We have over 25,000 kits, and we're expecting some more. The Chinese philanthropists gave us some kits. We have some on order. And we have also other philanthropists who have promised to help us with kits. But they must be used sensibly and wisely and judiciously. It's not like everybody requires a test. There are criteria for actually having a test, and that is that you have symptoms that suggest that you have coronavirus.
Right now, Honorable Minister, you can see that the numbers are growing by the day. The numbers of tested and confirmed cases are growing, and we've been trying to avoid, community infection, which would be very, very dangerous, for us as a nation, knowing the way we live our lives. We live in groups, we have several meetings and what have you. Now, what are the long or short-term measures being put in place, to ensure that we don't allow it, to enter the hinterland?
Very good. That's a very good question, and that is why we have been campaigning for the social distancing. Social distancing means that you are far away enough from somebody as to reduce the risk of being infected by that person from what we know of this virus. So, and also we are advocating people not to travel out, not to go around for unnecessary journeys, because if you are positive and you do not have symptoms and you do not know it, you travel out, you carry this virus with you. Most of these states where you have the virus now, almost certainly came from persons who left the initial group areas of Lagos or Abuja to go to those states. That's what we call seeding. This virus has been seeded to other states from travelers who have left the main hub of concentration of the virus. So reducing travel is a very helpful strategy. Reducing groups and large groups and avoiding crowds is extremely helpful, because you will be able to reduce the risk of someone coughing in your face or sneezing in your face and creating aerosols that can infect you.
Yes, Nigeria has been receiving financial support, from different quarters, and of course, if you look at what has been trending globally, it does appear that government alone cannot solve this problem, especially when it concerns the issue of procuring the facilities or tools or items required, especially the personal protective equipment, which is required for people in the front line, who are the doctors and nurses and other health workers who are directly involved, in combating this virus. So, what is the plan for this as well, for this group of people?
Well, we are first of all very grateful for all those to all those who have distributed something or promised to distribute something or to donate whatever it is that they are donating. They are very generous. We thank them for the empathy and the support. This is a national activity. I'm glad that everybody realizes that it's not only government that is going to handle this problem. Most of the donations are coming in kind, in form of materials, in form of PPE, as we are talking about. But we also know that there are those who want us to tell them what we need. So we tell them what we need, and then they bring those things for us. There are certain countries also who have mentioned that they have equipment and other kinds of commodities that we require. We intend to approach them and write to them to help us and help us with these commodities. We have received a lot of help from China. The United States has promised us help, and other countries, the United Kingdom, and above all, the World Health Organization has been very helpful, and they have been helpful with training. We have to train a lot of nurses and doctors. So we are receiving help from even private philanthropists. One philanthropy called me up this evening to promise us support up to the tune of 1 billion naira, which is really great, but it will be in kind. So they have asked for a list of what we need. Okay. So we are going to produce a list for our needs.
All right, everybody. So we'll take a short break now. When we come back, we'll show one more report, and we'll conclude this conversation. Thank you for coming, and please stay on. Let's take a short break now.
So you now want pick my call?
Then bomb me where? Mommy of life. Final, mommy.
Where my car?
Mommy, now small things remain.
If my car not ready for tomorrow, me and you go put leg inside one trouser. One lie.
Lost my phone. Yes, ma. Yes, ma. Yes, ma.
Not got this phone, no.
All right. Yes, ma. Hey,
Majekini.
Mommy, no be you. Don't waste your credit. When I finish, I go call.
You call me. Me wear my middle name na credit. Where Glow they give me boku.
Glow and Mebo. Get 5 times your recharge to call all networks. Recharge with *555* #PIN#.
This talk people. I beg give me phone, make I go, Joe.
Ah, talon so talk yen.
Unlimited.
Son, being good at something requires strength. It requires putting in more. That's why the new improved Bonvita is packed with vitality and a richer, creamier taste.
So sad. You're feeling blue cause you got nothing to do. You need to
step up to the max deal. Living good. The max deal.
Step up to the max deal. Get GoTV Max for less this month. GoTV. Live it, love it.
Nigerians, coronavirus is dangerous. It can kill. When you see this sign, high fever, cough, shortness of breath, drowsiness, pneumonia, don't panic, don't hide, don't embark in self-medication. Promptly visit the nearest medical facility. Report all cases to the nearest hospital. Prevention is key. Avoid contact with infected persons. Avoid crowded areas as much as possible. Wash your hands regularly. Use hand sanitizers. Your life is precious. Stay alive. Live long, live right. This message is sponsored by the Federal Ministry of Information and Culture and the Nigerian Film Corporation. Nigerian Film Corporation, powering possibility.
You're welcome back. Kano State government has continued to take proactive measures against the spread of COVID-19 in the state. Apart from deploying human and material resources in dealing with the emerging disease, the state government will upgrade the Yagaya Isolation Center with more equipment to meet global standards. Awal Salisu reports.
Nigeria continues to record more cases of COVID-19 on a daily basis. The emergency situation has compelled Kano State government to take more proactive measures to protect the safety and health of its citizenry. Latest among measures taken by the state government is the closure of all routes linking the state to other parts of the country. Other measures earlier taken include shutting down of schools and ministries, suspension of all social gatherings, as well as ban on luxurious buses bringing passengers into the state. Effort is also being geared to upgrade Ergaya and Kwanadawaki diagnostic centers to isolation facility to meet international standard.
The general renovation of this and provide other facilities, all consumables to make sure that they are available in this place.
The state government has put aside huge amount of money which is being utilized day in, day out in trying to see that the needful is done in our health facilities to cater for the common man and try to see that healthcare service delivery in the state is upped.
Government also embarked on rigorous enlightenment campaign to educate citizens on precautionary measures. In Kano, Awal Salisu, NTA News.
All right, back to the Honorable Minister. many have suggested that the gradual lockdown may not really work in Africa based on the way we live our lives. That could work in Europe. Isolation and the spacing where people are gathered and lockdown. Everybody must be indoors, and that of course yielded results with respect to stemming the tide of coronavirus in that country. What other measures do you think we can take to ensure that we do not have the experience of China or Italy?
Well, the first and the most important measure is to be fast and I will say aggressive in our case finding and in our testing, so that we reduce the risks, reduce the number of patients who are needing any kind of treatment. Now, the other measure are social measures, social distancing, as I've said, and reducing the congregations, gathering of people, and also the movement of people. There are countries like China who did carry out a very successful lockdown, because the lockdown means that they succeeded in interrupting the transmission. At the end of the day, every country has to adapt that method to their own peculiarities, to their own circumstances. And in Nigeria, we have been working out ways of doing that. We are working with NEMA, we are working with other humanitarian and civil organizations that will probably be on hand if there are needs that arise, even if we didn't lock down. So whether we lock down or not, we are preparing for the eventualities. The government has made that very clear, that it's responsible for the welfare and safety of all citizens.
All right, we talked about personal protective equipment. How much of it do we have in the country presently?
Well, I cannot give you figures, but we have a good number. We're expecting some more. We have placed order for more. We intend, as I said earlier, to write to some organizations and some countries who are producing PPEs to afford us the luxury of getting some of the ones that they are giving to countries, developing countries.
Now, is it possible to bring all the patients together in a location, to take proper care of them, especially when we have better facilities like Lagos? Is there a possibility?
Well, there are cases where you have to take persons who require intensive care or ventilators to a special care. But by and large, concerted treatment areas have to be created and where people will gather depending on location. But there will be no need for long distance transportation. You can carry persons from faraway places where they can be treated comfortably. The manifestation of the coronavirus, it can be mild, it can be moderate, can be severe, and it can be critical. So the critical cases are the ones that you really need for ICU and for...
All right. Thank you, Honorable Minister of Health. I'm sure you are having sleepless nights because of the situation, but I'm sure God will be on your side to, get it done. And Nigerians are hoping that this does not continue.
Thank you. We're hoping it doesn't, but we have to work hard for it.
Exactly. I've been speaking with the Minister of Health, Dr. Osagie Ehanire, on Weekend File tonight. We'll take another break. We'll be right back.